All right. Hello, everyone. This is Young Trin, and congratulations on the collaboration between Velocity and CogniView. Very excited, and very excited to hear that since our first chat, I guess a few months ago. So I unfortunately can't be with you during your meeting, and I have a conflicting meeting actually for a grant that we're doing. And I wanted to give you and answer some questions. I will be glad to have an additional live call with you guys for additional questions anytime. We just got to figure out a date that is convenient and where both you and I are available. So, in general, general feedback regarding the devices. Basically, this device we have used as a marketing tool, and we have also used as a pre-screen tool as well. And from a marketing perspective, patients love this device. You can do either the 5 minute Thrive or the 10 minute Clarity. But essentially, they enjoy the device because it's non-threatening compared to a Mocha or an MMSE, where a lot of folks walked out and with their heads down, feeling bad because they couldn't remember the 3 words or the 5 words or whatever. This device kind of gamifies the cognitive assessment in that they're just using that little joystick, and it feels like more like playing a game. And it's a little bit less intimidating for sure. We have had feedback from patients, and it's generally 90+% positive as far as the ease of use and feeling like they played more of a game as opposed to taking a test. That's the kind of feedback we've had over the last few years. How do I present the results to a patient? Essentially, uh, I normally let them know their scores immediately, and it doesn't have to be me. It could be whoever is using the device. The first thing we tell them is that this is not a tool that makes a diagnosis of Alzheimer's, because it's not, right? It's a screening of cognition. So we cannot make we're not able to tell you whether you have Alzheimer's or not with this tool. It's not designed that way. This is a tool really to tell us if you have a memory problem or not, or any of the other domains that are being tested. And it triggers a conversation, and it triggers the need for further workup. So somebody comes over and has a lower score on the CogniView test. Normally, I let them know that your score is lower than it should be based on your age and your and it requires further workup. I cannot tell you that this means you have Alzheimer's or anything else, but what this means is that one, you should see your primary care physician to let them know that you've taken a cognitive test that was not normal, and your primary care physician can take it from there. Usually, the doc will, look further into their medication history, do some labs, whatever it is, right, that they do for abnormal memory or abnormal cognition at the PCP office. So I let the PCP take it from there. Tell the patient to bring back their results. Print it out for them. You can print it out. You got a printer on the spot, and give those results directly to the PCP, where the patient can bring those results to the PCP to review. From a clinical research perspective, I use the device in 2 ways. One could be pre-screening at our office, or second, as a pre-screening tool at the community events that we do. So I often do these lectures that are sometimes 2 to 3 hours, right? These long seminars, and during these seminars, on the spot, we offer cognitive testing for those who are interested. and they would go to a room that's quiet, that's private, and that's designated for cognitive testing at the seminar itself, where folks get results immediately, and those who would score not normal can be certainly invited to our Alzheimer's research office, where we have a deeper discussion on their pre-screen and their test results. You don't have to have a abnormal test to invite them actually to your clinic, depending on what studies you have. So if you're doing a prevention study where their folks are looking for normal cognition, right? You can still invite those folks with normal results to your office who may fulfill those studies. The other thing is, how can you use this as a potential database where you collect scores? And obviously, that is something that we do at the office here. Folks who come into our office who do the cognitive testing, we will collect their scores and categorize it, whether it's normal, mildly abnormal, or more than mildly abnormal, and we can use that and pull that data for future clinical trials or current clinical trials that we have. I think that is super helpful. It's kind of like keeping score for a MOCA or an MMSE, except the cognitive device makes it a lot easier for us in terms of using specialized manpower. I don't have to pull a rater to do a cognitive testing or a PI or sub-I. I can use the cognitive device to collect those scores for me with a medical assistant or somebody at the front just turning on the machine, and so it helps out with our manpower and our bandwidth with our current staff with that. What else can I say to you? I'm wondering what other questions you may have here. But definitely you can use it to collect database to query for your studies, whether it's MCI, mild AD, or moderate, based on that. CogniView, I found, is a great marketing tool. Everyone wants to try out new technology, right? Nobody wants to come in just for MMSE. So I usually let folks know that we have a computerized device, FDA cleared, the first FDA cleared computerized device that will assess your memory, assess your cognition in 5 or 10 minutes, depending which device is being used. And patients are kind of excited about that. They're like, ooh, that's neat. I want to try it out, especially when their PCP doesn't have the same device, right? And so it's a great marketing tool that has worked well for us with that. What else can I tell you? I know CogniView is used in certain pharmacies. I've hooked up CogniView to be used at certain senior centers that I speak at, and other locations. Adult day centers are using CogniView, and it really funnels patients my way with abnormal scores. And usually these partnerships and collaborations will send folks our way who have an abnormal score and who is interested in speaking to Dr. Trin, right, or wherever the site is with that. So we can use it in many different ways with the devices. All right. I hope I've given you kind of an overview. I know we can go much deeper than this, and I'm sure you have additional questions. Set up a call with me. I'd love to talk to you guys at a future time and do a deeper dive as well. And again, congratulations on the collaboration between the two organizations. Take care, guys. Bye-bye.